performing nasotracheal suctioning, make sure the patient has no contraindications to the procedure, such as bleeding disorder, epiglottitis, and laryngospasm. Perform proper hand hygiene. Provide privacy of the patient. Introduce yourself to the patient. Hi ma'am, my name is Ria. I am your caregiver for today. May I know your name as well as your birthday?
My name is Chloe and my birthday is October 2, 2010.
Thank you. Monitor the oxygen level of the patient. This is my improvised oxygen level. Set up a little help to the patient into a semi-folders or sitting position. Connect one end of the tubing to the suction machine, then turn on. Set the pressure to lowest level that will effectively clear secretions. After checking the pressure by blocking the end of the tubing, place the open-ended tube near the patient or your work area. Now, prepare the suction catheter by opening the suction kit using aseptic technique. Use a towel and place it to the chest of the patient. Fill the tray compartment with 100 milliliters of sterile water. Open the water-soluble lubricant and squeeze onto the open sterile catheter package. Be careful not to touch the package depending on the agency's policy. You'll now apply either a pair of sterile gloves on your dominant hand and a clean gloves on your non-dominant hand. Your dominant hand to pick up the suction catheter without touching any non-sterile surface. And use your non-dominant hand to pick up the connecting tubing. Attach the catheter tubing to make sure that the equipment works properly. Suction a small amount of normal saline from the basin. Increase the patient's prescribed oxygen flow rate, instructing her to breathe slowly and deeply. Lightly coat 6 to 8 centimeters or 2.4 inches to 3.2 inches to the end of the catheter with a water-soluble lubricant. Mom, I'm going to go ahead and suction down your nose into your lungs to help get out some of those secretions. Ask the patient to inhale deeply. Use your dominant hand and forefinger to insert the catheter gently but quickly into one of her nares as she inhales. As you insert the catheter, do not cover the catheter vent. Follow the natural course of the nares. Orient the catheter downwards, don't force it. If you feel resistance, you've probably hit the carina. In that case, withdraw the catheter 1 to 2 centimeters between 0.4 and 0.8 inches before applying suction. When you're performing nasopharyngeal suctioning, a good general rule is to insert the catheter to roughly the same depth as the distance from the mouth or tip of the nose to the angle of the mandible. In adults, that's about 16 cm or 6.4 inches. In older children, 8 to 12 cm or 3 to 5 inches. And in infants and young children, about 4 to 7.5 centimeters or 1.6 to 3 inches. If you're performing nasotracheal suctioning, insert the catheter about 20 centimeters or 8 inches in an adult, 16 to 20 centimeters or 6 to 8 inches in an older child, and 8 to 14 centimeters or 3 to 5.5 inches in a young child. In some instances, turning the patient's head can help you suction more effectively. Turning to the right will help you reach the left main stem bronchus, and turning it to the left will help you reach the right main stem bronchus. Apply intermittent or continuous suction by placing your non-dominant hand over the vent of the catheter for 15 seconds or less. At the same time, slowly withdraw the catheter as you roll it back and forth between your dominant hand and forefinger. Go ahead, ma'am, and inhale deeply. Assess for the need to repeat the suctioning procedure, but don't perform more than 2 passes. Watch for alterations in the patient's cardiopulmonary status when possible. Allow adequate time, at least 1 minute, between suction passes to allow for ventilation and oxygenation. Rinse the catheter and connecting tubing by suctioning normal saline until the catheter and tubing have been cleared of secretions. When you finish suctioning, detach the catheter from the connecting tubing. Loop the catheter around the fingers of your dominant hand. Pull your gloves off, inside out around the cold catheter to isolate any contaminants. Remove the other gloves and turn off the suction machine. Dispose of your supplies in the appropriate receptacles. Remove the towel and dispose to the laundry basket. Reposition the patient. Are you okay, ma'am?
Breathing a little easier.
Perform proper hand hygiene. Document the procedure, including the pre- and post-suctioning assessment. Note the amount of consistency, color, and odor of secretions, the size of the catheter you use, and the patient's response to the care.